Hello, my name is Taylor Erfling. I am a first semester nursing student at Lincoln University. It is March 9th and 11 o'clock a.m. right now. I'm going to be performing a sterile wound dressing change. First, whenever I go in, I'm going to assess the patient 30 minutes prior to the procedure, and I'm going to get them into a comfortable position. Next, I'm going to go and assemble my equipment. I'm going to get the dressing change tray, my sterile gloves, 2 pairs of clean gloves, saline solution, cotton tip applicators, and 2 packages of gauze. Alright, then I'm going to enter the room. I'm going to perform hand hygiene and introduce myself to the patient. I'm going to explain the procedure that they're going to be doing, and I'm also going to identify the patient using 2 different identifiers, name and date of birth. After all of that's done, I'm going to provide privacy, and then I'm going to apply my clean gloves. Alright, now I am going to remove the dressing, kind of pulling it away from the skin, pushing on the skin to help remove the dressing better, making sure that I'm not damaging the skin as I'm removing it. Okay. Then I'm going to remove the gauze packing from top to bottom and from side to side. If there is any resistance with it, if it's sticking to the wound, I can apply some sterile solution to help moisten it and make it easier to remove. There we go. Alright, then I'm gonna wrap this up inside my glove and dispose of it in a biohazard container. Then I'm going to assess the wound for the drainage, the type of exudate and the odor, and the amount. I'm going to perform hand hygiene, and then I'm going to set up my sterile field. Alright. I'm going to open the tray away from me, and then I'm going to pick this up, making sure that you're only touching the sterile side. I'm going to make sure that I'm not crossing over my sterile field, so I will go to the other side of the table if necessary. There's a 1-inch border that is considered not sterile, along with on the off side of the table. So I have about 1 inch inside on to work with. Then I'm going to take the rest of the sterile supplies, and I'm going to dump them over 6 inches above, and then I'm going to dispose of this. I am also going to get my cotton tipped applicators at this time that are also sterile, and I'm going to open them over the sterile field and just let them drop in. Okay. Next, I am going to put some gloves on. And I'm going to clean the wound. I'm going to open my gauze away from me again, because these are sterile. Again, ensuring that I'm not crossing over the sterile field. I am going to pour the sterile solution into both to moisten the gauze, and then I'm going to set this aside so it's no longer in my way. I'm going to bring another pair of cotton tip applicators over so I can check for tunneling of the wound after I clean it. And now I'm going to take one piece of gauze at a time, and I'm going to clean the wound, going from in to out, being very gentle. And I'm going to make sure these are disposed of in a biohazard container. Right? Once it is clean, I am going to open this second set of cotton tipped applicators. Only need one. And I'm going to check for tunneling, measuring it in centimeters using a paper measuring tape that I bring into the room with me. and I'm going to be going around in a clockwise fashion, so 12 o'clock, 1 o'clock, 2 o'clock, and so on. I'm going to document any of my recordings. I'm going to dispose of that. Remove my gloves, and I am also going to take the gauze that I have used and dispose of it so that I do not get it confused with my sterile gauze. I'm going to perform hand hygiene once again, and now I'm ready for my sterile gloves. Okay. I'm going to open them so the letters are facing me. And the inside of this is considered sterile, so I want to make sure that I'm not touching the inside of it. I'm going to glove my dominant hand first, so I'm going to grab the non-sterile folded side. There we go. Folds back, just make sure that you're opening it, not touching the sterile side. Then, being very mindful of my thumb, I am going to pick up the glove only on the sterile side. Then I'm going to put it on. We'll adjust if necessary. And then I am going to pack the wound with the sterile gauze. I'm going to be using a cotton-tipped applicator. That one rolled off the sterile field, so it is no longer usable, so I'll use this one instead. I'm going to take the gauze, wring out any excess, unfold it, and then ensuring that I'm not touching the outside skin and compromising the sterility, I'm going to pack the wound. I'm going to make sure that I am not overpacking it. Be very conscious of that. Wring it out, pull it out, and then pack it. Again, making sure that you are not overpacking it. And do, I think, one more, and that should be enough. Okay. Once that is finished, I'm going to dispose of the applicator in a biohazard container. Then I'm going to take my sterile wound dressing, and I'm going to apply it over the top, making sure that it is the right size for the wound. You want to make sure it's not too large or too small. And then I'm going to fasten it in a windowpane fashion. Throughout this procedure, I'm going to be making sure that the patient is comfortable and note any signs of distress that they may exhibit for documentation later. For documenting, I am also going to document any notes that were made about the tunneling of the wound. There we go. And it's fastened. I'm going to initial, sign, and date, and remove my sterile gloves. Clean up my area and document.